you may have heard the pelvic inlet opens more with a posterior pelvic tilt. Therefore, the pelvic outlet must open more with an anterior pelvic tilt. Now, similarly to the pelvic inlet, we have an anterior and posterior portion that open more with an anterior tilt or a posterior pelvic tilt. However, when it comes to the pelvic outlet, we have two things that we're thinking about. One, we want our diaphragm to be stacked over the uterus to aid with our pushes, and that's going to happen better in either a slightly rounded position or a more neutral spine position. And so if we find a really big arch, this is going to decrease the efficiency of our pushes. The second thing is with internal hip rotation, which helps to create that side-to-side opening in the pelvic outlet. If we find more of an anterior pelvic tilt, this can actually put a lot of strain on our hip joint, because that is not the position that our pelvis wants to be in. We find internally rotated position.